What do I need to know if I have to go to the emergency room? How should I talk to the doctors and nurses there about AGS?
The primary thing to know when you go to the emergency department or urgent care is that if you have AGS, you have what the medical world and the scientific world we consider to be an IgE mediated allergy. And that's important because there are other forms of food intolerance that cause people to be distressed, but may not lead to anaphylaxis. And celiac disease or gluten hypersensitivity is a perfect example of that. People could be bothered, but it's not the same risk as that with an IgE based allergy. So it's one thing to know is that, if you're telling people about your allergy, they may not know what alpha gal is. So we often ask patients to lead with, I'm allergic to beef, pork, lamb, and anything derived from those mammals, and my allergy is an allergic one. It's IgE mediated or IgE based. And if you carry an EpiPen, you might even say, and I carry an auto injector. That typically will relay to the folks taking care of you that A, you know what you're talking about, B, it can be life threatening, and C, it lets them know about the medical things which they may need to think twice in terms of exposure. The biggest thing that we want physicians and nurse practitioners and other healthcare providers to know is that if you're allergic to mammal-based products, heparin is probably the most common medical treatment or therapy that could cause an issue. It certainly doesn't cause an issue for everyone, but there certainly are times where you would want to receive heparin regardless of your allergy because of the therapeutic benefit you could derive from it. So if you had a clot, you would want to get heparin, which is a blood thinner, and probably just deal with the allergic potential portion because the life-saving aspect of that may be well worth it. But it's certainly a discussion that you could at least have with your treating provider at that point in time. I don't think it's a forever rule out, I can never have this, because there may be times when the risk benefit is on the side of actually receiving heparin. That's the most common thing that comes up fairly routinely. It'd be unlikely to need an emergent heart valve replacement, but that would be another thing that comes up from time to time, would be if your providers were asking or thinking about putting a pig or cow derived heart valve in. Again, shouldn't necessarily be occurring in the emergency department. And it's probably really that we want them focused on heparin in those urgent situations.